Hey, everybody, and welcome back for a Tuesday lunch break with me, Ivana. If you are new here, we are glad that you're here. And today we are talking with our own Claire Vollers about a story that she wrote yesterday about how Birmingham is seeing a record number of coronavirus patients in UAB hospital, and also about just how the rate has gone up. The COVID rate statewide has gone up and increased the hospitalization rate. So Anna Claire wrote a story. We're going to link it in our comments below if you haven't read it and you want to take a deeper dive on it. Click that. And otherwise, Anna Claire is going to walk us through her reporting and also through the announcement that was made yesterday afternoon. So, Anna Claire, first of all, let's just go ahead and point out the kind of glaring part of this story where Dr. Marazzo, who is the director of infectious diseases at UAB, she said, quote, "I think we just now have widespread sustained community spread." And that is a very scary quote for a lot of us.
Yeah, I think a lot of us think that maybe some of these higher numbers have to do with, outbreaks in certain areas, like at nursing homes or at a specific workplace. But I asked her that, and she said no, that this is really due now to just so much virus being in the community. She had a quote that just kind of stopped me a little bit in my tracks. She said, "There's so much infection out there, you could go anywhere and potentially be exposed." So it sounds like our state experts here at UAB are extremely concerned about the numbers that they're seeing.
So when Dr. Marazzo said that you can pretty much go anywhere and you can expose yourself to coronavirus, she meant statewide, not just in Birmingham, correct?
Yeah, she meant statewide. I mean, there are hot spots around the state, but I think it's looking like the numbers are a lot higher almost everywhere than the experts would like to see them.
Right. Now, quickly, for those of y'all who are just joining us, thank you for joining us. If you have questions regarding the announcement yesterday from UAB about the increased COVID patients at the hospital or just increased rates in general, leave us a comment. I am watching them. And if you have anything we can answer, we will. Otherwise, we'll get back to you. So, back on this story, Anna Claire, something that also was interesting is that Dr. Marazzo talked about, I have some notes here I'm looking at. She said that there was about an 8% positive COVID test rate in the past several weeks and several months. Now, that means that of all the tests that came in across the state, about 8% came back positive. Now, in the past week or so, that rate had increased to 13% positive. And is that something that the officials at UAB were expecting, or was that higher than what they wanted to see?
I think that's pretty high. They were saying, you hear a lot about people saying, well, maybe the reason we have more positive cases now is just because they're testing a lot of people. And so she said, to get a better idea of how coronavirus is impacting our state, they look at the percentage of total cases tested, like you said, that come back positive. And um, it's been about 8% of the cases or the tests that come up positive for the past 2 weeks. But if you look at just the past week, that's 13%. And that is statewide. And then in Jefferson County alone, it's 10%. That's really high. She contrasted that with Seattle, which is where, the outbreak kind of originated a couple months ago. And they've got a 1.5% positive test rate. So ours is many, many more times that. And so that's really concerning to them.
This is a really good question from Rebecca. She says, are the numbers of people getting tested increasing, or have the numbers just been slacking and coming in? And that's a question that we have talked about, and we've all, I think, wondered out loud with the test numbers, and also with now with more people being able to have elective surgeries, going to the hospital, having to take a coronavirus test. Those testing numbers have gone up. But I know that Dr. Marazzo said in that announcement yesterday, she does not think that these increased case numbers are solely from increased testing. Correct?
Yeah, that's right. They are testing a lot more people, and I think it's worth pointing out that the more people that get tested, it ends up not being just the people who think that they have symptoms that are getting tested. Like you said, it's folks who are going into the hospital for maybe a routine surgery or something like that that are getting tested. People who need it to be able to go back to their workplace or something like that. So these are kind of relatively high percent positive rates, even when we are testing more and more people, and not just like at the beginning of this when we tested only people who seem to be sick.
That's a good thing to note, because like I said, I think that's something that everybody's first question comes to. Another question from Norma, and this is about the hospital capacity rate. Did Dr. Marazzo talk about that yesterday during her press conference along with Dr. Wilson from the Jefferson County Department of Health?
Yeah, so one of our, and I think it was in the headline of this piece, is that they are now treating at UAB inpatient 68 COVID patients, which is the highest number ever since this began. And he said, or Dr. Matzo said right now that they have the capacity at UAB and at other hospitals around the state to handle what's coming in right now. I think what they're concerned about is if the numbers keep going up, that's when you start running into them having to convert other parts of the hospital to COVID wards. That means that people who might need maybe a more elective or a less serious type surgery wouldn't be able to get it. And I think I've also heard from hospital folks in other parts of the state of Mobile who said that they saw people not coming into hospitals when they should have, when maybe they had stroke symptoms or heart attack symptoms, coming in a lot later because they were worried about COVID. And then that meant that they did not get the treatment they needed in the time that they needed. So as COVID cases go up, as hospitalizations go up, that kind of has ripple effects across the state.
Right. And now another question too about the ventilators. This is from our colleague Kent. And something I'm looking at my notes that UAB said yesterday that 68 of those people who are being treated right now for coronavirus in their hospital, about half of that is on ventilators. I'm not good at math, but I think that's about 34. So is that a number that has been increasing, or is that a pretty steady number?
So I think that's relatively steady. I asked specifically yesterday on the call how many folks were on ventilators, and they did not have that exact number. What they told me was that uh, traditionally and over the past couple months, about half the people that they treat at UAB are going to be on ventilators. So that's where that half of that 68 number comes from. I'm hoping that we might get some exact numbers eventually.
Now, this is another question from Edward. He said, these numbers, are there a total, or have they been separated by ages, such as seniors versus younger? Correct me and Claire if I'm wrong, but I think, Edward, we do not have that data on like demographics. We do have some data about there had not been deaths under the age of 25, I believe, of a person under the age of 25. But we do not have that exact data unless I'm wrong, Anna Claire.
The state keeps that data. UAB specifically did not release that. We have had a couple of younger folks, unfortunately, die within the past few weeks. There was an infant and a teenager, I believe, in the state. Now, I don't know that that was necessarily in Birmingham or at UAB, but I know they had that. If you go to the state's COVID website, they've got all of that broken out by race and age and everything. And you can actually, for Birmingham, the Jefferson County Health Department website has a lot of that broken out also that you can go look at.
Okay, awesome. Yeah, Edward, sorry, I was talking Birmingham. She's talking statewide. So you can get those statewide. We don't have those that information just for those specific people at UAB or in Jefferson County. So that is something you can find on the state's website. Now, a lot of questions here about masks. That is something that everybody's wanted to talk about. Everybody has had a lot of strong feelings on one way or the other. Something that the doctor said yesterday during her press conference, again, was that there is so much community spread that anybody can go just on a routine trip and just to a normal store. I don't mean trip as in a haul, and expect that they could be exposing themselves to the virus. And she did encourage people to wear their masks if they are going out, if they are going to be within 6 feet of other people. What else did she or Dr. Wilson or anybody else say about masks?
Yeah, they were really beating the drum pretty hard on masks yesterday. Just saying that we all really need to be wearing them. And Dr. Marazzo pointed out that the reason that she believes the reason we're seeing spikes or rising numbers right now is because people have kind of relaxed as the state has opened up. Everybody kind of thinks, well, maybe this isn't so bad. You know, we can go out in public. It's fine. I don't know anybody personally who has COVID. But they're saying that everybody relaxing those precautions, including not wearing masks in public or not social distancing, has led to this rise. And so they're saying if you go inside or out inside anywhere, grocery shopping, something like that, you need to be wearing a mask. And she gave a kind of interesting metric. She said, if you're looking at it, think about if you are in a place inside for 15 minutes or more and you are not 6 feet away from everybody, that is when alarm bells should start going off in your head. So she said 15 minutes less than 6 feet away from somebody. After that, your risk of infection goes up significantly.
That's a good metric, like you said, to kind of keep in mind. Had some other questions here about treatments, and that's something else that the doctor talked about yesterday during the update we got from UAB. So right now, there's only one FDA-approved antiviral treatment for coronavirus, and that is remdesivir. And she said that Alabama as a whole is running in pretty short supply of remdesivir. And again, that's a scary comment from the head of infectious diseases at UAB.
Yeah, the FDA removed its approval for hydroxychloroquine this week, I believe, just saying that it removed its approval for that. And so remdesivir is really the only approved antiviral treatment right now for COVID. And yeah, Dr. Morazzo said that there are not enough doses in Alabama to treat everybody that's in the hospital. Now, that doesn't mean that there are not other ways to treat people with COVID-19, but when you start looking at these effective antiviral treatments, we just don't have enough. So that's one more reason that everybody needs to be working on how to keep these numbers down.
Blake asking about the hydroxychloroquine and questions about that. Neither Anna Claire or I are doctors or researchers or in the medical field. So I'll try to get somebody on this week who can maybe speak a little bit more clearly to that, Blake, and anybody else asking about hydroxychloroquine, just because, like I said, we are not medical professionals and I don't want to steer you in the wrong direction. Now, there has been other questions that we're getting, several. I'm not going to put any on the screen because there's a bunch of y'all asking about the protests. And are these numbers increasing related to the different protests that have been across the state and across the country in the last week or so? Now, something, though, that the doctor mentioned yesterday was that our numbers are going up about 15 days after the Memorial Day weekend. So are we seeing the increase from Memorial Day? Are we seeing increase from protests, or is it clear?
Yeah, I asked that exact question to her, and she said it's probably a little bit. She based it based on the end of May, which is when the state started reopening, restaurants started reopening, but also that's right around Memorial Day. So that she did tie the rise specifically to those two things. I asked about protests, and she said, if you're going to a protest and it's outdoors, you're staying 6 feet away from people, and most everybody at the protest are wearing masks. She said that's a relatively low risk activity. Now, if you're in a huge group of people, like we've seen at some protests where everybody's very close together and not a lot of people wearing masks, then yeah, that's a higher risk. So she was not willing to necessarily tie all that specifically to one thing or another, but I think overall, this general opening and general relaxing of precautions that people are taking is what has led to the rise, she said.
Now, we've got Brenda Seymour asking where to get tested. Brenda, tell us what city you're in, and we'll try to give you an area or a list of locations for you. If you are in the Birmingham area, there is one downtown off of 24th Street or 22nd Street, I'm sorry, over downtown area. We'll get you where you need to go. Just give us your city and we will try to, one of my producers can help you and tell you, point you to some information that we have on AL.com about testing sites in your area. Now, looking again through some of all of your comments again about the drugs, is there any answer about why remdesivir is in short supply in Alabama? Is it in short supply nationwide or just specifically Alabama?
That I don't know. I would suspect that if it's in short supply here, it's probably in short supply everywhere, with it being the only FDA, right now, the only FDA approved antiviral. You can imagine, I'm sure there are a lot of places around the nation that are wanting to get this for their patients. So I don't know that, but I can find out.
Brenda says she's in Huntsville. I'm not in Huntsville. Anna Claire, you are in Huntsville. Do you know of testing locations in Huntsville?
There is, I believe, a flu and fever clinic on Governor's Drive that Huntsville Hospital operates. I think you need to call ahead of time. I've also heard that, if you have a doctor or somebody like that, or even a kind of a walk-in clinic, you can give them a call and ask if they do testing or where they would send you to get testing.
Awesome. Brenda, I hope that helps you. We hope that you are negative. And there's some other people giving us testing locations in the comments. We appreciate that. Question again about masks. We've got a lot of people that are saying the mask is not protecting you. If you're wearing the mask, it's protecting other people. Did anybody at the press conference yesterday go into any of that detail, or is that still the belief?
Yeah, I think it's a little bit of both. They said the more people who are wearing masks, the more overall protected that everybody is. And so all of the speakers yesterday, the folks from UAB, they wore masks up to the podium, and they strongly recommend that everybody wear masks. I think they said, a lot of people have never seen somebody on a ventilator. They've never seen people who are extremely sick from COVID in the hospital, and said that, if you had ever seen that you would automatically wear a mask, because it's just really, really devastating to watch how the disease works on the body. So they didn't go into the actual mechanics of that, but everybody was, I can tell you, very pro-mask yesterday.
I put up this comment on the screen from Linda. She says, when one of your family members gets COVID, you can change your mind about the mask. And that was actually something they talked about yesterday, Linda, at the press conference, was that, like Anna Claire just said, if you have not known somebody that had coronavirus, or if you've never seen anybody on a ventilator, whether that be coronavirus or just from another incident, that they believed that would definitely sway people and their thinking about coronavirus. And I just thought that was interesting. You said that, Linda, and that was something they said yesterday. Questions also about this flattening the curve and this first and second wave of coronavirus that we've heard about. Something that Dr. Marazzo said yesterday was that, I don't know why people are talking about a second wave. We're still in the first wave.
Yeah, that was interesting to me to hear her say that. I think she returned several times to talking about how, people assume that everything is getting back to normal, and that it's fine, just because, there are still a lot of people out there who may not actually know anybody who's had coronavirus, or who's had major complications from it. And so she's saying that we've never really left our first wave. And I know we've seen national experts talk about a potential second wave in the fall, and I'm not sure that we know that for sure, but she's saying this is still a problem, and a growing problem in Alabama right now.
And I know we've got a lot of people that have been concerned about the Montgomery region and about those cases going very high in the Montgomery region, and about them running out of hospitals in that region, not statewide, but in the Montgomery region. If you do have questions about that, I will be interviewing Montgomery Mayor Stephen Reed live on Thursday morning at 11 a.m. Give us your questions for Mayor Stephen Reed of Montgomery. We will make sure to ask them to the mayor. I know Montgomery is a place where the doctors have said there is widespread community spread, and those numbers are just going up in Montgomery. And do you have anything else that they mentioned yesterday at the press conference that is notable and that our viewers should make sure they know?
The only thing I can think of is that while you mentioned Montgomery, they did mention that as a particular hotspot, and asked about that. And they said that a lot from Montgomery is they're also seeing that the rural areas surrounding Montgomery, particularly in the Black Belt, are seeing really, really high rates. And that is bad, obviously, on its surface, but it's also particularly bad because folks who live in rural areas are, statistically speaking, more likely to have the kinds of health conditions that make coronavirus particularly dangerous. So like high blood pressure or diabetes or something like that. And so that was very concerning to them to see it, take hold in some of our more rural areas that haven't seen it yet.
Right. And I lied. I'm going to take one more question because I think that it is important. Leslie said she's going to Panama City. Have there been a lot of cases there? Something that we can tell you, Leslie, is that in this press conference yesterday, Dr. Marazzo said that one of the lower risk activities could be going to a beach and staying distance from other people. Right, Anna Claire?
Yeah, she did. She said if you're just hanging out at the beach, you're outdoors, you are not sitting within 6 feet of people outside of your immediate family. That's a really low risk activity. She said the problem is that you leave the beach and you go to a bar and you hang out there for a couple of hours with friends, and you're breathing the same air for a long time and sharing food or sharing drinks. She said that raises your risk of infection exponentially. So it kind of depends on how you do your beach trip. But if you're social distancing, if you're wearing a mask indoors and trying not to be indoors around other people when you can, that it remains relatively low risk.
We are so jealous of you, Leslie. I hope you have a wonderful time. Be safe, wear sunscreen, and we will be very jealous of you during next week. So thank all of you so much today for watching. If you have any other questions or if you want to know more, you can read Anna Claire's story. It is in the comments here, and that is where you can find all the information from yesterday's press conference from Dr. Marazzo and other officials in the Jefferson County area about the rising coronavirus hospitalizations. So again, thank you all for tuning in today. Thank you, Anna Claire, for coming on and explaining all of this to us and breaking it down. And for everybody else, we will see you tomorrow.